Hello, and welcome to my presentation for the SURE 2020 virtual conference. My name is Kyla Sinclair, and today I'll be presenting on my topic of a systematic review of the use of transcutaneous electrical nerve stimulation, or TENS, to reduce hemiplegic shoulder pain in the subacute phase of stroke rehabilitation using randomized controlled trials. Today I'll be covering background information on my topic, as well as the intervention, methods, results, and conclusion. So a stroke is defined as a neurological deficit attributed to an acute focal injury of the central nervous system by a vascular cause. And unfortunately, many of you may know someone who's been affected by a stroke. Public Health England in 2018 found that within the United Kingdom, stroke is one of the leading causes of death and disability, with 1 in 6 persons experiencing a stroke in their lifetime, and 65% of stroke survivors leaving the hospital with a disability. So amongst stroke survivor populations, approximately 21 to 72%, depending on the study, will experience hemiplegic shoulder pain, or HSP, with pain onset in the subacute phase of stroke rehabilitation. So HSP has been found to affect stroke recovery through increasing distress, reducing rehabilitation participation, and reducing functional arm recovery. So as you can see, it is important to find an appropriate intervention to treat HSP. TENS is an inexpensive, non-invasive form of electrical stimulation, which has been found to have analgesic effects based on the principles of gate control theory. TENS works by activating mechanoreceptor fibers, which when fire, inhibit nociceptive fibers from sending pain signals to the brain. To achieve my systematic review objective, I began with a Boolean search strategy on 2 databases, including Bournemouth University's MySearch and Web of Science back in October 2019. The strategy included key terms and their synonyms, as shown on this slide. From this search strategy, I obtained 461 results. Once duplicates were removed, articles were screened for eligibility using their titles and abstracts. Following this, full texts of articles were explored using the inclusion and exclusion criteria listed here. This Prisma diagram highlights the methods process from which I selected 5 studies to use in my research. A physiotherapy evidence database, or PEDRE scale, was utilized to evaluate the quality of the 5 identified RCT studies. The scale scrutinizes the studies based on 11 criteria categorized by randomization, concealed allocation, blinding key outcomes, and statistical analysis, and none of the studies were rejected based on their PEDRO scores. The results from the studies were collated into a data extraction table. Here is a sample of the population characteristics from the study. Here are the results for the study intervention of TENS. All of the studies varied in the time, frequency, and site of TENS application amongst the other combined intervention tools. Some of the studies, such as the last one, failed to supply some of the specific details, such as the TENS duration, electrode location, and TENS frequency, all important factors in discovering if there's any therapeutic effects. Here are the study results of pain outcome measures at baseline and after using TENS. In 4 of the studies, TENS reduced the incidence of HSP and pain scores over the intervention period. Interestingly, in one study, the TENS group demonstrated therapeutic efficacy at 4 weeks, but not at weeks 2 and 8. Similarly, another study found that pain intensity had increased at follow-up compared with immediate post-treatment pain intensity. Unfortunately, one study did not demonstrate any statistical significance in reported outcome measures. Overall, there is moderate evidence to support TENS in reducing hemiplegic shoulder pain in the subacute phase of stroke rehabilitation. The study results suggest that TENS has therapeutic benefits. However, due to the heterogeneity of the study measures, results are inconclusive about the degree of effectiveness for pain relief. Future research should aim to include more specific interventions and larger sample sizes to account for participant dropout. Thank you for taking the time to listen to my presentation today. On the following slides, you'll find references to support my research.